Hi, I'm Dr. Seth Force. I'm the Kamal A. Mansour Professor of Surgery and Chief of the Section of General Thoracic Surgery at Emory University Hospital in Atlanta. I think another very important thing about being a patient seeking out kind of a multidisciplinary cancer center is that they really, a patient with early stage lung cancer needs to be evaluated by the whole team. Oftentimes, we may come across a patient who was deemed to be inoperable or not a surgical candidate by someone who's not a surgeon. And that may be the case that they weren't a good candidate. Maybe they had bad heart disease or, bad lung function, but it oftentimes is not the case. And when we look at it, we say, well, we could have offered that patient surgery. And in fact, we did a study here several years ago looking at our outcomes in what would be considered high risk patients. So patients with multiple medical problems or poor pulmonary function. And we actually went and operated on those patients, and we had very good, early and long-term 5-year outcomes in those patients. So, I think it's very important that patients who have early stage lung cancer be seen by surgeons to see if they're operative candidates. If they're not, they need to be told why they're not. They need to be educated on their disease, on the risks, and they may sometimes take the option, say, no, I don't want surgery. But it's really critical, and that's been our practice, that even if a patient is seeking out just radiation therapy for an early lung cancer, we really want them to see a surgeon, just not to push for surgery. We never push it. I never push an operation on a patient, but to say, look, this is the operation, this is what it would do, these are the risks, these are the benefits, and you need to make a decision. And sometimes they come to my office and I tell them, yeah, I wouldn't, if you were my mother, father, I would not offer you surgery. The risks are too high, and that's fine. But I think it's really important that they know that, and that is in their medical record or their chart somewhere.